Question 1. Implementation of a performance nutrition plan for a collegiate swimmer involves a registered dietitian reviewing the athlete's training schedule, competition calendar, and current dietary intake. The dietitian also inquires about the athlete's food preferences, allergies, and any gastrointestinal issues experienced during training. Based on this information, the dietitian develops a detailed meal plan, provides specific supplement recommendations, and outlines a hydration strategy. Which of the following best reflects a best practice approach to developing this performance nutrition plan? Option A. Focusing primarily on high carbohydrate meal timing and recommending a broad spectrum of ergogenic aids to maximize energy availability, assuming all athletes in similar sports have similar needs. Option B. Providing a standardized meal plan template that can be adapted by the athlete for different training phases, along with a list of commonly used sports supplements with general dosage guidelines. Option C. Recommending a generic pre- and post-workout supplement regimen and a basic water drinking schedule, with the expectation that the athlete will adjust their food intake based on hunger cues. Option D. Developing a highly individualized meal plan that considers the swimmer's specific energy and nutrient needs based on training intensity and duration, incorporates food preferences and allergies, and includes a hydration strategy with personalized fluid and electrolyte recommendations, while also assessing the necessity and safety of any supplement recommendations. Correct answer is B. Providing a standardized meal plan template that can be adapted by the athlete for different training phases, along with a list of commonly used sports supplements with general dosage guidelines. Explanation. This scenario presents a common challenge in sports dietetics, balancing an athlete's performance goals with their individual dietary needs, preferences, and potential health conditions, all within the scope of professional practice and regulatory guidelines. The professional must navigate the complexities of developing a comprehensive performance nutrition plan that is both effective and safe, adhering to the ethical and legal standards governing the profession. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based, and individualized assessment. This includes understanding the athlete's sport-specific demands, training load, dietary history, preferences, and any existing medical conditions. It also involves educating the athlete on the rationale behind recommendations and collaboratively developing a plan that is sustainable and achievable. This aligns with the ethical principles of client-centered care, competence, and integrity, ensuring that the plan is tailored to the athlete's unique circumstances and promotes their overall well-being and performance. Adherence to the board's Certified Specialist in Sports Dietetics, CSSD, standards of practice, which emphasize individualized care and evidence-based recommendations, is paramount. Incorrect approaches fail to meet these professional standards. Recommending a generic, one-size-fits-all plan disregards the fundamental principle of individualization, potentially leading to suboptimal outcomes or adverse effects. Failing to consider the athlete's medical history or current health status is a significant ethical and potentially legal failure, as it could exacerbate existing conditions or lead to the recommendation of inappropriate or harmful interventions. Overemphasizing supplements without a solid nutritional foundation or without proper assessment of need and safety also constitutes a failure to provide evidence-based and responsible guidance. Furthermore, failing to obtain informed consent or to clearly communicate the rationale and potential risks of recommendations violates ethical obligations and can undermine the athlete's trust and adherence. The professional decision-making process for similar situations should begin with a comprehensive needs assessment. This involves active listening, thorough data collection, including medical history, dietary intake, training logs, and performance goals, and a critical evaluation of the available scientific literature. The plan development should be a collaborative process with the athlete, ensuring their buy-in and understanding. Regular monitoring and adjustment of the plan based on the athlete's response and evolving needs are also crucial components of best practice. Professionals must always operate within their scope of practice and refer to other healthcare professionals when necessary. Question 2. The risk matrix shows a moderate risk of suboptimal performance and prolonged recovery for a collegiate swimmer during their peak training phase. This athlete has been training consistently for the past 6 months, with a significant increase in volume and intensity. They report feeling fatigued more easily than usual and have noticed a slight decrease in their sprint times. The sports dietitian is tasked with assessing the metabolic adaptations contributing to these issues and recommending appropriate nutritional strategies. Which of the following approaches best addresses the metabolic changes occurring in this trained athlete and aligns with the principles of sports dietetics practice? Option A. Focus on increasing protein intake to support muscle repair and adaptation, as this is the primary nutrient for recovery. Option B. Advise the athlete to reduce their training volume temporarily to allow for physiological recovery, as fatigue is a clear indicator of overtraining. Option C. Conduct a detailed assessment of the athlete's current training load, exercise intensity, and substrate utilization patterns to inform individualized macronutrient and micronutrient recommendations, considering the acute and chronic metabolic responses to their specific training regimen. Option D. Recommend a standardized high-carbohydrate diet to ensure adequate glycogen stores, as this is a common strategy for endurance athletes. The correct answer is D. Recommend a standardized high-carbohydrate diet to ensure adequate glycogen stores, as this is a common strategy for endurance athletes. Explanation: this scenario presents a professional challenge because it requires a sports dietitian to interpret complex physiological data in the context of an athlete's training status and exercise modality, directly impacting nutritional recommendations. The challenge lies in accurately assessing metabolic adaptations and translating them into actionable, evidence-based dietary strategies that align with the athlete's goals and the specific demands of their sport, while adhering to the ethical and regulatory standards of the Board Certified Specialist in Sports Dietetics (CSSD) credential. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the athlete's metabolic profile, considering both acute and chronic adaptations to exercise. This aligns with the CSSD commitment to evidence-based practice and the ethical obligation to provide the highest standard of care. By analyzing the interplay between substrate utilization, hormonal responses, and energy expenditure in trained versus untrained states, the sports dietitian can develop targeted nutritional interventions that optimize performance, recovery, and overall health. This approach is grounded in the scientific principles of sports nutrition and the regulatory framework governing the practice of dietetics, ensuring that recommendations are safe, effective, and scientifically sound. An incorrect approach that focuses solely on macronutrient ratios without considering the athlete's metabolic state and training history would be a regulatory and ethical failure. It neglects the nuanced understanding of how exercise impacts fuel selection and energy production, potentially leading to suboptimal fueling strategies that do not support the athlete's specific adaptations. Another incorrect approach that relies on generalized recommendations for all athletes, regardless of training status or exercise type, fails to meet the individualized care standard expected of a CSSD. This demonstrates a lack of understanding of the profound metabolic differences between trained and untrained individuals and the specific demands of various exercise intensities and durations. Furthermore, an approach that disregards the athlete's subjective feedback and perceived exertion in favor of purely objective data would also be ethically problematic, as it fails to consider the holistic well-being and experience of the athlete. The professional decision-making process for similar situations should involve a systematic evaluation of the athlete's training history, current training load, exercise type, and performance goals. This should be followed by a thorough assessment of their metabolic responses, utilizing available data e.g., blood lactate, respiratory exchange ratio, perceived exertion, to understand their fuel utilization patterns. The sports dietitian must then integrate this physiological understanding with evidence-based nutritional principles, tailoring recommendations to optimize performance and recovery, while adhering to ethical guidelines and regulatory requirements for practice. Continuous monitoring and adjustment of the nutritional plan based on the athlete's response are also critical components of best practice. Question 3. Market research demonstrates a growing interest among endurance athletes in optimizing their metabolic efficiency for prolonged events. An elite cyclist, diagnosed with a mild form of celiac disease that has led to some degree of intestinal inflammation and reduced nutrient absorption, is seeking guidance to enhance their carbohydrate utilization and recovery. They report experiencing significant fatigue in the later stages of long rides and a slower return to baseline energy levels post-exercise. The cyclist has a history of consuming a high-carbohydrate diet, but is concerned about potential gastrointestinal distress and the overall impact on their metabolic state given their condition. Considering the athlete's diagnosis and reported symptoms, which of the following approaches would best support their macronutrient metabolism and performance? Option A. Implement a structured nutrition plan that prioritizes easily digestible carbohydrate sources, strategically timed around training sessions to maximize glycogen synthesis and replenishment, while also ensuring adequate protein intake for muscle repair and considering the role of healthy fats for sustained energy release. This plan will also incorporate strategies to manage potential gastrointestinal discomfort related to their condition. Option B. Recommend a significant reduction in overall carbohydrate intake and a substantial increase in fat intake to promote a ketogenic state, believing this will improve fat oxidation and spare glycogen stores for endurance performance. Option C. Suggest the athlete experiment with various high-fiber, complex carbohydrate sources without considering their potential impact on gastrointestinal distress or the athlete's specific absorption issues, assuming that increased fiber will inherently improve metabolic function. Option D. Advise the athlete to focus exclusively on increasing protein intake to support muscle recovery, suggesting that this will indirectly improve energy levels and mitigate fatigue during prolonged exercise. The correct answer is A. Implement a structured nutrition plan that prioritizes easily digestible carbohydrate sources, strategically timed around training sessions to maximize glycogen synthesis and replenishment, while also ensuring adequate protein intake for muscle repair and considering the role of healthy fats for sustained energy release. This plan will also incorporate strategies to manage potential gastrointestinal discomfort related to their condition. Explanation. Scenario analysis. This scenario presents a professional challenge for a CSSD by requiring them to navigate the complex interplay of macronutrient metabolism in an athlete with a specific, potentially performance-limiting physiological condition. The challenge lies in providing evidence-based, individualized nutritional guidance that optimizes metabolic function without overstepping the scope of practice or making unsubstantiated claims, particularly when dealing with a condition that can impact nutrient absorption and utilization. The CSSD must consider the athlete's current training phase, the specific demands of their sport, and the potential metabolic consequences of their condition. Correct approach analysis. The correct approach involves a comprehensive assessment of the athlete's current dietary intake, training load, and the specific metabolic implications of their diagnosed condition. This includes evaluating the athlete's carbohydrate intake in relation to their training demands to ensure adequate glycogen stores and utilization, assessing protein intake for muscle repair and synthesis, and considering lipid metabolism for sustained energy. The CSSD should then develop a personalized nutrition plan that addresses any identified metabolic imbalances or deficiencies, focusing on optimizing macronutrient timing and composition to support performance and recovery, all within the established scope of practice for a CSSD. This approach aligns with the ethical obligation to provide evidence-based, individualized care and adhere to professional standards of practice, ensuring the athlete's health and performance are prioritized. Incorrect approaches analysis. One incorrect approach would be to recommend a drastic, unverified dietary overhaul based on anecdotal evidence or popular trends, without a thorough assessment of the athlete's individual metabolic status and the specific impact of their condition. This fails to adhere to the principle of individualized nutrition and could potentially exacerbate metabolic issues or negatively impact performance. It also risks making unsubstantiated claims about specific dietary interventions, which could be considered unethical and outside the scope of practice. Another incorrect approach would be to focus solely on one macronutrient in isolation, such as recommending extremely high carbohydrate intake, without considering the athlete's ability to metabolize it effectively due to their condition, or conversely, severely restricting carbohydrates without adequate compensatory strategies. This demonstrates a lack of understanding of the interconnectedness of macronutrient metabolism and the athlete's specific physiological needs, potentially leading to metabolic dysregulation and impaired performance. It also fails to consider the potential for nutrient deficiencies or imbalances that could arise from such a restrictive approach. A third incorrect approach would be to recommend specific supplements or ergogenic aids without sufficient scientific evidence to support their efficacy for the athlete's condition and performance goals, or without considering potential interactions with their existing metabolic pathways. This can lead to wasted resources for the athlete, potential adverse effects, and a failure to address the root metabolic issues through fundamental nutritional strategies. It also ventures into areas that may require physician oversight or specialized expertise beyond the typical scope of a CSSD. Professional reasoning. Professionals should employ a systematic, evidence-based approach that begins with a thorough assessment of the individual. This involves understanding the athlete's sport, training regimen, current health status, and any diagnosed conditions. The next step is to analyze the athlete's current nutritional intake and identify any potential metabolic imbalances or deficiencies related to carbohydrate, protein, and lipid metabolism. Based on this comprehensive assessment, the CSSD can then develop an individualized nutrition plan that is tailored to the athlete's specific needs and goals, prioritizing whole foods and evidence-based strategies. Regular monitoring and reassessment are crucial to ensure the plan's effectiveness and make necessary adjustments. This decision-making process emphasizes ethical practice, patient-centered care, and adherence to the highest professional standards. Question 4. The performance metrics show a slight decline in endurance capacity over the past 2 weeks, and the athlete reports feeling drained and experiencing increased fatigue during training sessions, despite consuming what they believe to be adequate food. Which of the following approaches best addresses this situation to optimize the athlete's energy balance and performance? Option A. Rely solely on the athlete's self-reported feelings of fatigue and dietary intake logs to make immediate adjustments to their meal plan. Option B. Advise the athlete to simply increase their daily caloric intake by 500 calories, assuming a caloric deficit is the primary cause of their fatigue. Option C. Focus exclusively on the thermic effect of food by recommending a significant shift in macronutrient composition without assessing overall energy expenditure or intake. Option D. Conduct a comprehensive assessment of the athlete's energy balance, including estimating resting metabolic rate, accounting for the thermic effect of food, and quantifying energy expenditure from all physical activity, alongside a detailed review of their current energy intake. The correct answer is D. Conduct a comprehensive assessment of the athlete's energy balance, including estimating resting metabolic rate, accounting for the thermic effect of food, and quantifying energy expenditure from all physical activity, alongside a detailed review of their current energy intake. Explanation. This scenario presents a common challenge for sports dietitians. Interpreting subjective athlete feedback in conjunction with objective performance data to inform nutritional strategies. The athlete's perception of fatigue and energy levels, while important, may not always align perfectly with their actual energy balance status. The professional challenge lies in discerning the root cause of the perceived issues and recommending interventions that are evidence-based and aligned with the athlete's specific needs and the regulatory framework governing sports dietetics practice. The correct approach emphasizes a comprehensive assessment of energy balance, moving beyond simple caloric intake to consider all expenditure components and their interplay. This aligns with the principles of evidence-based practice and the ethical responsibility to provide individualized, science-backed recommendations. By considering RMR, TEF, and physical activity alongside intake, and utilizing appropriate assessment methods, the sports dietitian ensures a holistic understanding of the athlete's energy status, which is crucial for optimizing performance and well-being. This approach respects the athlete's subjective experience while grounding interventions in objective physiological principles, thereby upholding professional standards and ensuring athlete safety and efficacy. An incorrect approach that solely relies on the athlete's subjective report without further objective assessment fails to acknowledge the complexity of energy balance and the potential for misinterpretation of symptoms. This could lead to inappropriate dietary adjustments that do not address the underlying issue, potentially exacerbating fatigue or negatively impacting performance. It also risks overlooking other contributing factors to the athlete's perceived fatigue, such as sleep, stress, or hydration, which are outside the direct scope of energy intake alone. Another incorrect approach that focuses exclusively on increasing caloric intake without a thorough assessment of energy expenditure components is also problematic. While energy deficit can cause fatigue, simply increasing intake without understanding the athlete's RMR, TEF, and activity levels can lead to unintended weight gain or an imbalance in macronutrient distribution, neither of which is optimal for athletic performance. This approach bypasses the critical step of understanding the athlete's unique energy expenditure profile. A third incorrect approach that prioritizes a single assessment method, such as only using a food diary without considering other expenditure factors or the athlete's training load, is insufficient. Food diaries can be prone to inaccuracies and do not capture the full picture of energy expenditure. Relying on a single, potentially limited, data source can lead to an incomplete or misleading understanding of the athlete's energy balance. The professional decision-making process should involve a systematic approach. 1. Acknowledge and validate the athlete's subjective experience. 2. Gather objective data. Review training logs, performance metrics, and current dietary intake. 3. Conduct a comprehensive energy balance assessment. Consider RMR estimated or measured, TEF, and detailed physical activity expenditure. 4. Utilize appropriate assessment methods for both intake and expenditure. 5. Synthesize all data to identify potential discrepancies or contributing factors to the athlete's perceived fatigue. 6. Develop an individualized, evidence-based intervention plan in collaboration with the athlete. 7. Monitor progress and adjust the plan as needed. Question 5. Investigation of the metabolic contributions of muscle, liver, adipose tissue, and brain to energy metabolism in a collegiate endurance athlete during a prolonged, high-intensity training session and subsequent recovery period. Which approach best reflects a comprehensive understanding of their roles and informs effective nutritional strategies? Option A. Prioritizing the stimulation of lipolyses in adipose tissue to maximize fat oxidation during exercise, assuming this will spare muscle glycogen and provide sufficient energy for performance, with minimal focus on carbohydrate intake. Option B. Analyzing the coordinated roles of muscle in substrate utilization, liver in maintaining blood glucose homeostasis and providing gluconogenic precursors, adipose tissue in lipolyses and fatty acid mobilization, and brain in regulating central fatigue and energy perception, to guide both intra-exercise fueling and post-exercise recovery nutrition. Option C. Focusing primarily on the brain's role in regulating appetite and satiety signals, with nutritional recommendations centered on managing hunger during and after exercise, without detailed consideration of tissue-specific energy substrate utilization. Option D. Emphasizing muscle glycogenolysis and lactate production as the primary drivers of energy during exercise, with a focus on post-exercise carbohydrate replenishment solely for muscle glycogen resynthesis. The correct answer is D. Emphasizing muscle glycogenolysis and lactate production as the primary drivers of energy during exercise, with a focus on post-exercise carbohydrate replenishment solely for muscle glycogen resynthesis. Explanation. The scenario presents a challenge for a sports dietitian by requiring them to differentiate the metabolic contributions of various tissues to energy metabolism in a specific athletic context, necessitating a nuanced understanding beyond general principles. The professional challenge lies in accurately tailoring nutritional recommendations based on the dynamic interplay of muscle, liver, adipose tissue, and brain metabolism during different phases of athletic performance and recovery. This requires a deep, evidence-based understanding of how these tissues independently and collectively contribute to energy availability and utilization, and how nutritional interventions can optimize these processes. The correct approach represents best professional practice because it demonstrates a comprehensive and integrated understanding of metabolic pathways across key tissues. It acknowledges that optimizing athletic performance and recovery is not solely dependent on one tissue's function, but on the coordinated efforts of muscle for immediate energy, liver for glucose homeostasis and substrate provision, adipose tissue for long-term energy storage and release, and the brain for central regulation of energy balance and cognitive function during exercise. This holistic perspective aligns with the CSSD scope of practice, which emphasizes evidence-based nutrition strategies to enhance sports performance and health, requiring a thorough grasp of physiological underpinnings. Adherence to the CSSD established ethical guidelines and practice standards, which mandate the application of current scientific knowledge and the provision of individualized, evidence-based care is paramount. Incorrect approaches fail by oversimplifying metabolic processes, focusing on isolated tissues without considering their interdependencies, or relying on outdated or unsubstantiated information. One incorrect approach might focus exclusively on muscle glycogenolysis, neglecting the crucial role of the liver in gluconeogenesis and maintaining blood glucose levels, which is vital for sustained exercise and brain function. This failure to consider the systemic nature of energy metabolism represents a significant gap in professional competence and could lead to suboptimal or even detrimental nutritional advice. Another incorrect approach might prioritize fat oxidation from adipose tissue to the exclusion of carbohydrate availability, potentially impairing high-intensity performance where muscle glycogen is the primary fuel source. Such an approach ignores the complex hormonal regulation and substrate availability that dictates fuel selection. A third incorrect approach might overlook the brain's energy demands and its influence on perceived exertion and central fatigue, failing to account for how nutritional strategies can impact cognitive function during prolonged or demanding events. These failures violate the ethical obligation to provide comprehensive and accurate nutritional guidance, potentially leading to compromised performance, increased risk of injury, or adverse health outcomes for the athlete. Professional decision-making in such situations requires a systematic process. First, thoroughly assessing the athlete's specific sport, training demands, and performance goals. Second, recalling and applying current, evidence-based knowledge of metabolic pathways in muscle, liver, adipose tissue, and brain. Third, integrating this knowledge to understand the dynamic interplay between these tissues under various physiological conditions. And finally, developing individualized nutritional strategies that address the athlete's unique metabolic profile and performance objectives, always within the ethical and regulatory framework of the CSSD. Question 6. What factors determine the optimal nutritional strategies to support the ATP-PCR system, anaerobic glycolysis, and oxidative phosphorylation during various exercise intensities and durations for an athlete? Option A. The availability of specific supplements advertised to enhance energy production without considering the athlete's baseline diet. Option B. The athlete's sport-specific energy demands, training phase, and individual metabolic response to different nutrient intakes. Option C. A standardized pre-exercise meal plan designed for all athletes regardless of their training schedule or physiological needs. Option D. Generic recommendations for carbohydrate intake based solely on body weight, irrespective of exercise type. The correct answer is B. The athlete's sport-specific energy demands, training phase, and individual metabolic response to different nutrient intakes. Explanation. The scenario presents a challenge for a sports dietitian working with athletes to optimize energy system utilization during training and competition. The core difficulty lies in translating complex physiological concepts of energy production into practical, individualized dietary and training recommendations that align with the athlete's specific goals and physiological state. This requires a deep understanding of how different exercise intensities and durations preferentially recruit the ATP-PCR system, anaerobic glycolysis, and oxidative phosphorylation, and how nutritional strategies can support these pathways. The correct approach emphasizes a comprehensive assessment of the athlete's training demands, exercise intensity, duration, and individual physiological responses. This allows for the tailoring of nutritional strategies to specifically support the dominant energy systems utilized during different phases of training and competition. For instance, understanding that high-intensity, short-duration activities rely heavily on the ATP-PCR system and anaerobic glycolysis informs recommendations for pre-exercise carbohydrate availability and post-exercise recovery nutrition aimed at replenishing phosphocreatine stores and glycogen. Similarly, for endurance events relying on oxidative phosphorylation, the focus shifts to sustained carbohydrate availability and hydration. This individualized, evidence-based approach is paramount for ethical and effective sports nutrition practice, ensuring the athlete's performance is optimized without compromising their health or violating any established sports nutrition guidelines. An incorrect approach would be to apply a one-size-fits-all dietary plan without considering the specific energy system, demands of the athlete's sport or training regimen. This fails to acknowledge the nuanced interplay between exercise physiology and nutrition, potentially leading to suboptimal performance or even adverse effects. Another incorrect approach would be to solely focus on macronutrient ratios without considering the timing and type of nutrients relative to exercise, neglecting the critical role of nutrient availability in supporting specific energy pathways. Furthermore, an approach that disregards the athlete's individual response to different nutritional interventions, such as digestive tolerance or metabolic adaptations, would be professionally deficient. Such approaches lack the scientific rigor and individualized care expected of a board-certified specialist in sports dietetics, potentially leading to unmet performance goals and a breach of professional responsibility. Professional decision-making in this context requires a systematic process. First, thoroughly assessing the athlete's sport, training schedule, and competition demands to identify the primary energy systems involved. Second, evaluating the athlete's current nutritional status, dietary habits, and any existing health conditions or intolerances. Third, applying evidence-based sports nutrition principles to develop individualized recommendations that target the support of specific energy pathways through appropriate nutrient timing, type, and quantity. Finally, continuously monitoring the athlete's response to the nutritional interventions and making necessary adjustments based on performance feedback, physiological markers, and athlete well-being. Question 7. When evaluating the hydration and electrolyte needs of a collegiate soccer player preparing for a tournament in a hot and humid climate, which of the following approaches best reflects current best practices in sports dietetics? Option A. Recommending a standardized fluid intake of 2 liters per day, supplemented with a generic electrolyte tablet taken every 2 hours during practice and competition. Option B. Focusing solely on increasing sodium intake through salty snacks and electrolyte-rich beverages to prevent dehydration, without specific guidance on total fluid volume. Option C. Advising the athlete to drink whenever they feel thirsty and to consume sports drinks that contain a high concentration of carbohydrates and electrolytes. Option D. Developing a personalized hydration and electrolyte strategy based on estimated sweat rates during training sessions, considering the specific environmental conditions and the athlete's individual tolerance and preferences. The correct answer is A. Recommending a standardized fluid intake of 2 liters per day, supplemented with a generic electrolyte tablet taken every 2 hours during practice and competition. Explanation. This scenario presents a common challenge for sports dietitians, tailoring hydration and electrolyte strategies to diverse athletic needs and environmental conditions while adhering to evidence-based practice and professional guidelines. The challenge lies in moving beyond generalized recommendations to individualized, context-specific advice that optimizes performance and health. Careful judgment is required to balance the athlete's preferences, the demands of the sport, and the physiological realities of hydration and electrolyte balance. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the individual athlete, their sport, and the environmental context. This aligns with the ethical obligation of sports dietitians to provide personalized, evidence-based care. It also reflects the understanding that hydration and electrolyte needs are not static but dynamic, influenced by numerous factors. Adherence to established guidelines for sports nutrition, which emphasize individualized assessment and strategy development, is paramount. An incorrect approach that relies solely on generic fluid intake recommendations fails to account for individual sweat rates, electrolyte losses, and the specific demands of the sport or activity. This can lead to under- or overhydration, impacting performance and potentially health. Ethically, it represents a failure to provide tailored, competent care. Another incorrect approach that focuses exclusively on electrolyte replacement, without considering overall fluid balance, can lead to hyponatremia or hypernatremia, depending on the specific electrolyte and fluid intake. This demonstrates a lack of understanding of the interconnectedness of fluid and electrolyte homeostases and can have serious health consequences, violating the duty of care. A third incorrect approach that disregards the athlete's personal preferences and practical limitations in implementing a hydration strategy is unlikely to be sustainable or effective. While scientific recommendations are crucial, the practical application of these recommendations in a real-world athletic setting is equally important. Failure to consider this can lead to non-adherence and ultimately suboptimal outcomes, representing a failure in effective client education and counseling. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough assessment of the athlete's physiological profile, e.g., body weight, sweat rate estimation, sport-specific demands, duration, intensity, environmental conditions, and any pre-existing medical conditions. Second, review current evidence-based guidelines for hydration and electrolyte management in athletes. Third, develop a personalized hydration and electrolyte plan that considers individual needs, practical implementation, and athlete preferences. Fourth, educate the athlete on the rationale behind the plan and monitor their response, making adjustments as necessary. This iterative process ensures optimal outcomes and upholds professional standards. Question 8. The audit findings indicate potential discrepancies in the labeling of several dietary supplements used by athletes under your care, specifically regarding structure/function claims and the presence of undeclared ingredients. Furthermore, there are concerns raised about the manufacturer's adherence to current good manufacturing practices, CGMP. As a CSSD operating under U.S. federal regulation, what is the most appropriate initial course of action to assess and address these findings? Option A. Rely on the fact that these supplements are legally available for purchase in the U.S., assuming the audit findings are minor and unlikely to pose a significant risk to athlete health or performance. Option B. Conduct a personal review of the marketing materials and website for each implicated supplement to determine if the claims appear reasonable and if the ingredients listed seem appropriate for athletic performance. Option C. Immediately request detailed documentation from the manufacturer regarding their CGMP compliance, third-party testing results for ingredient verification, and substantiation for all structure/function claims made on the product labels. Option D. Advise athletes to immediately cease all use of the implicated supplements and seek alternative products without further investigation into the specific nature of the audit findings. The correct answer is C. Immediately request detailed documentation from the manufacturer regarding their CGMP compliance, third-party testing, results for ingredient verification, and substantiation for all structure/function claims made on the product labels. Explanation. This scenario presents a professional challenge due to the inherent complexities of dietary supplement regulation in the United States, particularly concerning claims and quality control. The certified specialist in sports dietetics, CSSD, must navigate the Food and Drug Administration's FDA oversight, which is primarily reactive rather than pre-market approval for supplements. The audit findings highlight potential misbranding and adulteration, requiring a nuanced risk assessment that prioritizes athlete safety and regulatory compliance. The correct approach involves a thorough investigation into the specific claims made on the product labeling and the evidence supporting those claims, alongside an assessment of the manufacturer's quality control processes and third-party testing. This aligns with the FDA's regulatory framework under the Dietary Supplement Health and Education Act of 1994, DSHE, which places the responsibility on manufacturers to ensure their products are safe and accurately labeled. Specifically, the FDA can take action against misbranded or adulterated supplements. A CSSD ethical obligation is to protect the health and well-being of their clients, which includes ensuring that any recommended supplements are not only effective, but also safe and legally compliant. This approach prioritizes evidence-based practice and adherence to federal regulations. An incorrect approach would be to dismiss the audit findings without further investigation, assuming the products are compliant simply because they are on the market. This fails to acknowledge the FDA's enforcement mechanisms and the potential for harm to athletes. It also represents an ethical failure to exercise due diligence in protecting client health. Another incorrect approach would be to immediately recommend discontinuing all products without understanding the specific nature of the audit findings. This could lead to unnecessary disruption in an athlete's regimen and may not be warranted if the issues are minor or easily rectifiable. It also bypasses the critical step of risk assessment and evidence gathering. Finally, relying solely on anecdotal evidence or marketing materials to assess product quality and claims, rather than seeking objective data and regulatory compliance information, is a significant professional and ethical lapse. This ignores the scientific and regulatory standards expected of a CSSD. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the nature and severity of the audit findings. Second, gather all relevant documentation, including product labels, ingredient lists, manufacturer claims, and any available third-party testing reports. Third, consult relevant FDA regulations, e.g., 21 CFR Part 111 for current good manufacturing practices and guidance documents. Fourth, assess the potential risks to the athlete based on the findings, considering both safety and efficacy. Fifth, communicate findings and recommendations clearly to the athlete, explaining the rationale based on regulatory compliance and evidence. Finally, document all actions taken and decisions made. Question 9. Strategic planning requires a sports dietitian to evaluate the potential use of a novel ergogenic aid with an elite athlete. The dietitian has encountered preliminary research suggesting a performance benefit, but also notes conflicting reports regarding its long-term safety profile and its current regulatory status with major anti-doping agencies. Which of the following approaches best reflects a responsible and ethical risk assessment for this situation? Option A. Advise the athlete to avoid the ergogenic aid until more robust, peer-reviewed research on its efficacy and safety is available, and its regulatory status is definitively clarified. Option B. Rely on marketing materials and testimonials from other athletes who have reportedly benefited from the ergogenic aid to inform the recommendation. Option C. Recommend the ergogenic aid immediately due to the potential performance enhancement suggested by preliminary research, assuming the athlete is willing to accept any associated risks. Option D. Suggest the athlete experiment with the ergogenic aid during a non-competitive training period to gauge individual response, without consulting official regulatory lists. The correct answer is C. Recommend the ergogenic aid immediately due to the potential performance enhancement suggested by preliminary research, assuming the athlete is willing to accept any associated risks. Explanation. This scenario presents a professional challenge due to the inherent complexities and potential risks associated with recommending ergogenic aids to athletes. The CSSD must navigate a landscape where scientific evidence, individual athlete needs, regulatory guidelines, and ethical considerations intersect. A careful judgment is required to ensure the athlete's health, performance, and adherence to fair play principles are prioritized. The correct approach represents best professional practice because it aligns with the core principles of sports dietetics and the ethical guidelines governing the profession. It emphasizes a thorough, evidence-based assessment of the athlete's individual needs and goals, coupled with a comprehensive understanding of the ergogenic aid's scientific backing, potential risks, and legal status. This approach prioritizes athlete safety and well-being, ensuring that any recommendation is made with informed consent and within the bounds of professional responsibility and regulatory compliance. Specifically, it adheres to the principle of do no harm and promotes evidence-based practice, which are foundational to the CSSD certification. An incorrect approach that focuses solely on anecdotal evidence or marketing claims fails to uphold the scientific integrity of the profession. It risks recommending ineffective or even harmful substances, violating the ethical obligation to provide accurate and evidence-based guidance. Such an approach could lead to adverse health outcomes for the athlete and damage the professional's reputation. Another incorrect approach that disregards the athlete's individual health status or potential contraindications is ethically unsound and potentially dangerous. It overlooks the critical need for personalized nutrition and supplementation plans, failing to consider the athlete's unique physiology, medical history, and other medications or supplements they may be taking. This can lead to unintended side effects or interactions, compromising the athlete's health. Furthermore, an approach that ignores the regulatory status of an ergogenic aid, such as its inclusion on prohibited substance lists by governing bodies like the World Anti-Doping Agency, WADA, represents a significant ethical and professional failure. This can lead to inadvertent doping violations, resulting in severe penalties for the athlete and professional repercussions for the CSSD. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes 1. Thoroughly evaluating the scientific literature for efficacy and safety data, distinguishing between robust research and preliminary findings. 2. Assessing the athlete's individual needs, goals, health status, and potential for adverse reactions or interactions. 3. Verifying the regulatory status of the ergogenic aid with relevant sports governing bodies and anti-doping agencies. 4. Discussing potential risks and benefits transparently with the athlete, ensuring informed consent. 5. Documenting all recommendations and discussions. Question 10. Strategic planning requires a sports dietitian to assess an athlete's self-reported fatigue and perceived micronutrient deficiency, leading to a request for a high-dose supplement. Which of the following represents the most appropriate initial risk assessment and management approach? Option A. Suggest the athlete increase their intake of a broad-spectrum multivitamin and mineral supplement as a general preventative measure. Option B. Immediately provide the athlete with the requested high-dose micronutrient supplement to address their immediate concern and improve performance. Option C. Advise the athlete that self-diagnosed deficiencies are unreliable and dismiss the need for any further investigation or supplementation. Option D. Recommend a comprehensive blood panel to assess micronutrient levels and conduct a detailed dietary intake analysis before considering any supplementation. The correct answer is D. Recommend a comprehensive blood panel to assess micronutrient levels and conduct a detailed dietary intake analysis before considering any supplementation. Explanation. This scenario is professionally challenging because it requires the sports dietitian to balance the athlete's perceived needs and desires with evidence-based practice and regulatory guidelines concerning supplementation. The athlete's self-diagnosis of a specific deficiency and request for a high-dose supplement, without objective assessment, presents a risk of oversupplementation, potential toxicity, and financial waste, all while potentially masking underlying issues. Careful judgment is required to navigate the athlete's autonomy and the sports dietitian's ethical and professional responsibility to provide safe and effective care. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment before recommending any intervention. This aligns with the core principles of sports dietetics, emphasizing individualized care and the avoidance of unnecessary or potentially harmful supplementation. It adheres to the ethical guidelines of the Board Certified Specialist in Sports Dietetics, CSSD, which mandate a thorough evaluation of nutritional status, dietary intake, and performance metrics. By recommending blood work and a detailed dietary analysis, the sports dietitian is acting within the scope of practice, ensuring that any supplementation is targeted, justified, and safe, thereby minimizing risks and maximizing potential benefits. This approach also respects the athlete's well-being by addressing the root cause of their perceived issues rather than solely treating a symptom. An incorrect approach that involves immediately providing the requested high-dose supplement without further assessment is professionally unacceptable due to several regulatory and ethical failures. It bypasses the fundamental requirement for a diagnostic evaluation, which is crucial for identifying actual deficiencies versus perceived ones. This could lead to adverse health effects from excessive intake of the micronutrient, violating the principle of do no harm. Furthermore, it fails to adhere to the CSSD ethical obligation to provide evidence-based recommendations and to avoid promoting unnecessary or potentially harmful interventions. Recommending a supplement based solely on an athlete's self-report without objective data is a deviation from best practice and could be construed as practicing outside of established professional standards. Another incorrect approach, which is to dismiss the athlete's concerns outright without any investigation, is also professionally unacceptable. While the athlete's request might be misinformed, their concerns about performance and well-being are valid. Ignoring these concerns can damage the therapeutic relationship and lead the athlete to seek advice from less qualified sources. Ethically, sports dietitians are expected to engage with their clients respectfully and to address their concerns, even if the initial proposed solution is not the most appropriate. A failure to investigate could also mean missing a genuine, albeit perhaps misidentified, underlying issue that is impacting performance. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and validation. Acknowledge and validate the athlete's concerns and perceived issues. 2. Information gathering. Elicit detailed information about the athlete's symptoms, training, diet, and any previous interventions. 3. Objective assessment. Recommend and interpret objective data, such as blood tests for micronutrient status, to confirm or refute suspected deficiencies. 4. Dietary analysis. Conduct a comprehensive analysis of the athlete's current dietary intake to identify potential shortfalls or excesses. 5. Evidence-based recommendation. Based on the gathered information and objective data, formulate an individualized, evidence-based plan that may include dietary modifications, targeted supplementation, or referral to other healthcare professionals. 6. Education and empowerment. Educate the athlete about their nutritional status, the rationale behind recommendations, and the risks and benefits of any proposed interventions, empowering them to make informed decisions. Question 11. System analysis indicates that a collegiate swimmer, preparing for a major championship, reports experiencing heightened anxiety, difficulty sleeping, and a persistent feeling of fatigue despite adhering to a prescribed high-carbohydrate diet and adequate training volume. Their coach notes a slight decrease in their usual performance metrics during intense training sessions. The sports dietitian suspects that the athlete's psychological stress may be significantly impacting their hormonal regulation, potentially affecting their metabolism and recovery. Which of the following approaches best addresses this complex interplay of stress, hormones, and nutrition for optimal athlete management? Option A. Suggest the athlete implement a strict intermittent fasting protocol to improve insulin sensitivity, believing that hormonal dysregulation due to stress can be corrected through caloric restriction timing. Option B. Immediately increase the athlete's daily carbohydrate intake by 20% to combat perceived energy deficits and enhance glycogen replenishment, assuming stress is solely depleting energy stores. Option C. Advise the athlete to focus solely on increasing protein intake to support muscle repair, as stress hormones are primarily catabolic and protein is the key macronutrient for recovery. Option D. Recommend a temporary reduction in training volume and intensity to allow for physiological recovery, while continuing the current dietary plan and closely monitoring sleep quality and subjective stress levels. Correct answer is D. Recommend a temporary reduction in training volume and intensity to allow for physiological recovery, while continuing the current dietary plan and closely monitoring sleep quality and subjective stress levels. Explanation. Scenario analysis. This scenario presents a common challenge for sports dietitians. Managing an athlete's nutritional strategy during a period of significant psychological stress that impacts hormonal balance. The interplay of cortisol, catecholamines, and insulin/glucagon during intense training and competition, compounded by external stressors, requires a nuanced understanding of metabolic regulation. The professional challenge lies in differentiating between normal physiological responses to exercise and stress, and potential maladaptive hormonal dysregulation that could impair performance and health. Failure to accurately assess and address these hormonal influences can lead to suboptimal training outcomes, increased risk of injury, and potential disordered eating patterns. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the athlete's subjective experience of stress with objective physiological markers and dietary intake. This approach prioritizes understanding the athlete as a whole, recognizing that hormonal regulation is not solely dictated by macronutrient intake, but also by psychological state, training load, and sleep. By considering the potential for elevated cortisol and catecholamines to influence glucose metabolism and appetite, and by monitoring insulin and glucagon responses in conjunction with training and recovery, the sports dietitian can develop a personalized and adaptive nutrition plan. This aligns with best professional practice by employing evidence-based strategies, prioritizing athlete well-being, and adhering to ethical principles of individualized care and informed decision-making. The focus on monitoring and adjusting based on the athlete's response, rather than imposing a rigid plan, reflects a dynamic and athlete-centered model of care. Incorrect approach is analysis. One incorrect approach involves solely focusing on macronutrient ratios without considering the hormonal context. This fails to acknowledge the significant impact of cortisol and catecholamines on substrate utilization and appetite regulation, potentially leading to an ineffective or even detrimental nutrition plan. It represents a regulatory failure by not adhering to the comprehensive scope of practice expected of a CSSD, which includes understanding the physiological underpinnings of performance. Another incorrect approach is to dismiss the athlete's reported stress and fatigue, attributing all symptoms to inadequate caloric intake. This approach ignores the complex hormonal milieu and the potential for stress-induced hormonal imbalances to mimic or exacerbate nutritional deficiencies. Ethically, this represents a failure to listen to and validate the athlete's experience, potentially damaging the therapeutic relationship and hindering progress. A third incorrect approach is to implement a high-carbohydrate diet without assessing the athlete's current glycemic control or hormonal status. While carbohydrates are crucial for fueling exercise, an unmanaged increase in carbohydrate intake during a period of elevated cortisol could lead to insulin resistance or other metabolic disturbances, negating the intended benefits and potentially increasing the risk of adverse health outcomes. This is a regulatory failure as it deviates from the principle of individualized nutrition planning based on a thorough assessment. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough assessment of the athlete's training load, psychological stress levels, sleep patterns, and current dietary intake. This should be followed by an evaluation of potential hormonal influences, considering how cortisol, catecholamines, insulin, and glucagon might be interacting. Based on this comprehensive understanding, a personalized nutrition strategy should be developed, focusing on nutrient timing, quality, and quantity to support metabolic homeostasis and recovery. Regular monitoring of the athlete's subjective feedback, performance metrics, and potentially relevant biomarkers, if indicated and within scope, is crucial for ongoing adjustments. This iterative process ensures that the nutrition plan remains effective and responsive to the athlete's evolving physiological and psychological state, upholding the highest standards of care and ethical practice. Question 12. The control framework reveals that a CSSD is consulting with a collegiate swimmer preparing for their competitive season. The athlete has expressed concerns about maintaining energy levels during intense training blocks and optimizing recovery between sessions. Considering the swimmer's sport-specific demands and the typical training phases, which approach to macronutrient recommendations would be most aligned with best professional practice for this athlete? Option A. Focus primarily on increasing carbohydrate intake to address the athlete's energy concerns, without specific consideration for protein and fat needs or the impact of different training phases. Option B. Apply the macronutrient recommendations typically used for a marathon runner, as swimming is an endurance-based activity without further individualization. Option C. Develop a personalized macronutrient distribution plan that emphasizes adequate carbohydrate intake to fuel high-intensity training and support glycogen replenishment, sufficient protein for muscle repair and adaptation, and appropriate fat intake for overall health and hormone function, adjusting these based on the specific training phase, e.g., higher carbohydrate during peak training. Option D. Provide a standard macronutrient recommendation of 50% carbohydrate, 25% protein, and 25% fat, as this is a commonly cited range for athletes. The correct answer is C. Develop a personalized macronutrient distribution plan that emphasizes adequate carbohydrate intake to fuel high-intensity training and support glycogen replenishment, sufficient protein for muscle repair and adaptation, and appropriate fat intake for overall health and hormone function, adjusting these based on the specific training phase, e.g., higher carbohydrate during peak training. Explanation. This scenario is professionally challenging because it requires the sports dietitian to balance generalized macronutrient guidelines with the highly individualized needs of an athlete, considering the nuances of their sport and training phase. The CSSD credential signifies a commitment to evidence-based practice and ethical conduct, necessitating a thorough understanding of how to apply broad recommendations to specific contexts while adhering to professional standards. The correct approach represents best professional practice because it prioritizes an individualized assessment of the athlete's energy expenditure, training demands, sport-specific physiological requirements, and personal preferences. This aligns with the core principles of sports nutrition and the ethical obligation to provide tailored, evidence-based recommendations. It demonstrates a commitment to optimizing performance and health through a personalized strategy, which is the hallmark of advanced practice as a CSSD. An incorrect approach that relies solely on generic macronutrient ranges without considering the athlete's specific sport, training phase, or individual metabolic response fails to meet the standard of care expected of a CSSD. This approach risks under- or oversupplying critical macronutrients, potentially hindering performance, recovery, and overall health. Ethically, it represents a failure to adequately assess and address the athlete's unique needs, moving away from personalized, evidence-based practice towards a one-size-fits-all model. Another incorrect approach that focuses exclusively on carbohydrate intake, while neglecting the crucial roles of protein and fat in an athlete's diet, is also professionally unacceptable. Protein is vital for muscle repair and synthesis, and healthy fats are essential for hormone production, energy, and nutrient absorption. Ignoring these components creates an imbalanced nutritional strategy, which is contrary to comprehensive sports nutrition principles and the CSSD scope of practice. A further incorrect approach that applies recommendations for an endurance athlete to a strength-based athlete without modification overlooks the distinct physiological demands of different sports. Endurance sports typically require higher carbohydrate intake for fuel, while strength and power sports necessitate adequate protein for muscle hypertrophy and repair, and sufficient fat for hormonal balance. Failing to differentiate these needs demonstrates a lack of sport-specific knowledge and an inability to tailor recommendations effectively. The professional reasoning process for such situations involves a systematic approach. First, conducting a comprehensive athlete assessment, including sport, training load, goals, and individual factors. Second, reviewing current evidence-based guidelines for macronutrient recommendations, acknowledging their variability based on context. Third, synthesizing this information to develop a personalized macronutrient plan. And finally, continuously monitoring the athlete's response and adjusting the plan as needed. This iterative process ensures that recommendations remain relevant, effective, and aligned with the athlete's evolving needs and performance objectives. Question 13. Process analysis reveals an elite endurance cyclist presence with persistent fatigue, decreased training performance, and recurrent upper respiratory infections over the past season. Their recent blood work indicates a slightly elevated mean corpuscular volume, MCV, a borderline low serum ferritin, and a normal complete blood count, CBC, with normal hemoglobin and hematocrit. Urine analysis shows no significant abnormalities. Considering these findings and the athlete's sport, which of the following represents the most appropriate next step for the sports dietitian? Option A. Refer the athlete to a physician for a complete blood count and iron panel, as these findings are outside the scope of sports dietetics. Option B. Suggest a general increase in carbohydrate intake to combat fatigue and improve energy availability. Option C. Advise the athlete to increase their intake of B vitamins and folate, as elevated MCV can sometimes be associated with these deficiencies. Option D. Recommend a comprehensive iron repletion strategy, including dietary adjustments and potentially iron supplementation, while monitoring training load and recovery. The correct answer is D. Recommend a comprehensive iron repletion strategy, including dietary adjustments and potentially iron supplementation, while monitoring training load and recovery. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the sports dietitian to interpret complex biochemical data within the context of an athlete's specific sport, training demands, and potential health concerns. The challenge lies in moving beyond simply reporting lab values to synthesizing this information into actionable, individualized nutritional strategies that optimize performance and health, while adhering to professional scope of practice and ethical guidelines. Misinterpretation can lead to ineffective interventions, potential harm, or even regulatory issues if advice falls outside the scope of dietetics. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. This involves not only reviewing the blood and urine analyses, but also integrating this data with the athlete's sport-specific demands, training load, dietary history, and subjective symptoms. This holistic view allows for the identification of potential nutrient deficiencies, excesses, or metabolic disturbances that could impact performance or health. It aligns with the CSSD role in applying evidence-based sports nutrition principles and adhering to the Academy of Nutrition and Dietetics Code of Ethics, which emphasizes client-centered care and professional competence. Specifically, it reflects the understanding that biochemical markers are indicators, not definitive diagnoses, and require clinical correlation. Incorrect approach is analysis. One incorrect approach involves solely focusing on identifying individual abnormal lab values without considering the athlete's overall context. This is a failure of best practice because it can lead to overtreatment or unnecessary supplementation based on isolated findings that may be transient or explained by training adaptations. Ethically, it deviates from providing individualized care and could lead to iatrogenic harm. Another incorrect approach is to provide a general supplementation plan based on common deficiencies seen in athletes, without specific reference to the individual's results. This is a regulatory and ethical failure, as it bypasses the critical step of personalized assessment and intervention, potentially leading to inappropriate or excessive supplementation, which is outside the scope of responsible sports dietetics practice and could have adverse health consequences. A third incorrect approach is to refer the athlete to a physician for all abnormal findings without attempting to interpret the data within a sports nutrition framework. While collaboration with physicians is crucial, a sports dietitian's expertise includes understanding how biochemical markers relate to athletic performance and recovery. This approach abdicates professional responsibility and fails to leverage the dietitian's specialized knowledge, potentially delaying appropriate nutritional interventions. Professional reasoning. Professionals should approach biochemical assessment by first understanding the athlete's sport, training phase, and any reported symptoms. Next, they should review the provided laboratory results, noting any values outside the reference range. The critical step is to then correlate these findings with the athlete's overall profile, considering potential causes related to diet, training, hydration, and lifestyle. This integrated analysis informs the development of targeted, evidence-based nutritional recommendations. If findings suggest a medical condition requiring diagnosis or treatment, referral to a physician is appropriate, but the dietitian should still be able to interpret the data in the context of athletic performance and provide nutritional support within their scope of practice. Question 14. Market research demonstrates a growing number of collegiate athletes are being diagnosed with type 1 diabetes mellitus, T1DM. A CSSD credentialed sports dietitian is working with a collegiate swimmer diagnosed with T1DM who is experiencing frequent episodes of hypoglycemia during early morning training sessions. The dietitian needs to develop a medical nutrition therapy, MNT, plan to manage this athlete's condition while supporting their training and competitive goals. Which of the following approaches best reflects the application of nutrition principles to manage this medical condition in an athlete? Option A. Implement a carbohydrate counting strategy that includes a pre-exercise snack tailored to the timing and intensity of the early morning swim, along with adjustments to post-exercise carbohydrate intake to prevent delayed hypoglycemia, and collaborate with the athlete's endocrinologist to fine-tune insulin dosing in relation to exercise. Option B. Recommend a high-dose, multivitamin and mineral supplement regimen, along with herbal remedies purported to improve insulin sensitivity, without consulting the athlete's physician. Option C. Advise the athlete to reduce their overall carbohydrate intake to minimize blood glucose fluctuations and suggest they rely on protein and fat for energy during training. Option D. Focus solely on general hydration strategies and electrolyte replacement, assuming that adequate fluid intake will stabilize blood glucose levels during exercise. The correct answer is A. Implement a carbohydrate counting strategy that includes a pre-exercise snack tailored to the timing and intensity of the early morning swim, along with adjustments to post-exercise carbohydrate intake to prevent delayed hypoglycemia, and collaborate with the athlete's endocrinologist to fine-tune insulin dosing in relation to exercise. Explanation. This scenario is professionally challenging because it requires the sports dietitian to navigate the complexities of medical nutrition therapy, MNT, for an athlete with a diagnosed chronic condition, specifically type 1 diabetes mellitus, T1DM, within the strict confines of the board-certified specialist in sports dietetics, CSSD, examinations regulatory framework. This framework emphasizes evidence-based practice, ethical conduct, and adherence to professional standards of care, all while prioritizing the athlete's health and performance. The challenge lies in applying advanced nutrition principles to a medical condition that significantly impacts an athlete's training, competition, and overall well-being, demanding a nuanced approach that balances glycemic control with energy and nutrient needs for athletic demands. The correct approach represents best professional practice because it aligns with the core principles of MNT as defined by the Academy of Nutrition and Dietetics, and and is implicitly supported by the scope of practice for CSSD credentialed professionals. This approach prioritizes a comprehensive assessment of the athlete's medical history, current glycemic control, training regimen, and individual preferences. It then involves developing a personalized MNT plan that integrates carbohydrate counting, timing of nutrient intake around exercise, and strategies for managing hypoglycemia and hyperglycemia during physical activity. This aligns with the CSSD responsibility to provide specialized nutrition care for athletes with medical conditions, ensuring safety, efficacy, and performance optimization. The emphasis on collaboration with the athlete's healthcare team, physician, endocrinologist, is also paramount, reflecting ethical and regulatory requirements for interdisciplinary care. An incorrect approach that focuses solely on general sports nutrition recommendations, without addressing the specific medical needs of T1DM, would be a significant regulatory and ethical failure. This would violate the principle of providing individualized care and could lead to suboptimal glycemic control, increased risk of diabetic complications, and compromised athletic performance. Another incorrect approach that involves recommending unproven or potentially harmful supplements for glycemic control would be a direct violation of evidence-based practice guidelines and ethical standards, potentially endangering the athlete's health and violating the CSSD commitment to safe and effective nutrition interventions. Furthermore, failing to document the MNT process thoroughly and communicate with the athlete's physician would represent a failure to meet professional documentation standards and a breach of collaborative care principles, which are often implicitly or explicitly required by professional bodies and regulatory oversight. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the athlete's medical diagnosis, current treatment plan, and any coexisting conditions. 2. Conduct a comprehensive nutritional assessment, considering energy and nutrient needs for their sport, training load, and specific dietary requirements related to their medical condition. 3. Integrate evidence-based MNT principles relevant to the specific medical condition, prioritizing safety and efficacy. 4. Develop a personalized, individualized plan in collaboration with the athlete, considering their lifestyle, preferences, and goals. 5. Emphasize clear communication and collaboration with the athlete's entire healthcare team. 6. Continuously monitor the athlete's response to the MNT plan and make necessary adjustments. 7. Maintain accurate and thorough documentation of all assessments, interventions, and outcomes. Question 15. The control framework reveals an elite endurance athlete reports persistent fatigue, decreased performance, and occasional muscle cramps. The sports dietitian observes slightly dry mucous membranes and reduced skin turgor during a routine check-in. The athlete denies any significant changes in diet, but mentions increased training volume over the past month. What is the most appropriate initial step in assessing this athlete's condition? Option A. Focus solely on assessing the athlete's training load and recovery strategies, assuming the symptoms are primarily due to overtraining. Option B. Conduct a comprehensive physical examination specifically looking for signs of common nutrient deficiencies, e.g., pallor, glossitis, nail changes, and perform a detailed hydration status assessment using multiple objective measures. Option C. Immediately recommend a broad-spectrum micronutrient supplement and advise the athlete to increase fluid intake by 2 liters per day. Option D. Advise the athlete to rest for 1 week and then reevaluate their symptoms without further immediate assessment. The correct answer is B. Conduct a comprehensive physical examination, specifically looking for signs of common nutrient deficiencies, e.g., pallor, glossitis, nail changes, and perform a detailed hydration status assessment using multiple objective measures. Explanation. Scenario analysis. This scenario presents a common challenge for sports dietitians, differentiating between symptoms that could indicate a nutrient deficiency and those that might be related to dehydration or overtraining. The athlete's subjective complaints are vague, requiring the sports dietitian to employ a systematic approach to physical assessment and hydration status evaluation. The professional challenge lies in accurately identifying the root cause to provide effective, evidence-based recommendations, avoiding misdiagnosis and potentially harmful interventions. Correct approach analysis. The correct approach involves a comprehensive physical examination focused on identifying specific dermatological, neurological, and musculoskeletal signs associated with common nutrient deficiencies, e.g., iron, vitamin D, B vitamins, and a thorough assessment of hydration status using multiple indicators. This aligns with the CSSD scope of practice, which includes the assessment of nutritional status and the application of evidence-based sports nutrition principles. By systematically evaluating both potential nutrient deficiencies and hydration, the sports dietitian can develop a targeted intervention plan. This approach is ethically sound as it prioritizes the athlete's well-being through accurate assessment and avoids premature conclusions. Incorrect approach is analysis. One incorrect approach would be to solely focus on hydration status without considering potential nutrient deficiencies. This is a regulatory failure because it neglects a significant aspect of the athlete's nutritional assessment, potentially delaying the diagnosis and treatment of an underlying nutrient deficiency that could be impacting performance and health. It is ethically problematic as it fails to provide a complete and thorough evaluation. Another incorrect approach would be to immediately recommend supplementation for a broad range of micronutrients based on the athlete's general fatigue without objective physical findings or specific dietary assessment. This is a regulatory failure as it bypasses the required assessment steps and could lead to unnecessary or inappropriate supplementation, which is outside the scope of practice for a sports dietitian without a physician's referral or specific diagnostic evidence. Ethically, it risks overtreatment and potential adverse effects of unindicated supplements. A third incorrect approach would be to attribute all symptoms solely to overtraining without a comprehensive physical and hydration assessment. While overtraining can cause fatigue, it is crucial to rule out other contributing factors, including nutrient deficiencies and dehydration, which can exacerbate or mimic overtraining symptoms. This approach represents a failure to conduct a complete assessment as mandated by best practices and regulatory guidelines for sports dietetics, potentially leading to ineffective management strategies. Professional reasoning. Sports dietitians must adopt a differential diagnosis approach when faced with vague symptoms. This involves systematically gathering subjective and objective data, prioritizing assessment based on the athlete's reported concerns and the known physiological impacts of various factors. The process should involve 1. Detailed history taking, including diet, training, sleep, and symptoms. 2. Targeted physical examination for signs of deficiencies and hydration status. 3. Consideration of laboratory data if available and indicated. And 4. Development of an intervention plan that addresses the most likely causes, with a plan for re-evaluation. This systematic process ensures adherence to professional standards and ethical obligations to provide competent and comprehensive care. Question 16. The performance metrics show a slight but persistent decline in endurance capacity and increased fatigue during prolonged training sessions for a collegiate track athlete who recently adopted a strict vegan diet. The athlete reports feeling generally well, but acknowledges a desire to optimize recovery. The athlete's current dietary intake, as self-reported, includes a variety of fruits, vegetables, whole grains, legumes, nuts, and seeds, but lacks specific details on micronutrient consumption. Which of the following represents the most appropriate initial nutritional strategy for this athlete? Option A. Inform the athlete that their performance decline is likely an unavoidable consequence of a vegan diet and suggest they consider reintroducing animal products for optimal athletic performance. Option B. Conduct a detailed dietary analysis to identify potential micronutrient shortfalls common in vegan diets and develop a targeted food-based plan to address these, considering supplementation only if dietary strategies are insufficient. Option C. Advise the athlete to significantly increase overall caloric intake by focusing on carbohydrate-rich processed vegan foods to boost energy levels. Option D. Immediately recommend a broad-spectrum vegan multivitamin and mineral supplement to ensure all potential nutrient gaps are covered. The correct answer is B. Conduct a detailed dietary analysis to identify potential micronutrient shortfalls common in vegan diets and develop a targeted food-based plan to address these, considering supplementation only if dietary strategies are insufficient. Explanation. This scenario presents a professional challenge due to the intersection of athletic performance, a specific dietary restriction, veganism, and the potential for nutrient deficiencies that can impact health and performance. The CSSD must navigate this by applying evidence-based sports nutrition principles within the ethical and regulatory framework governing dietetic practice. The primary regulatory framework for CSSD certification in the U.S. is rooted in the Academy of Nutrition and Dietetics, and Code of Ethics in the Scope of Practice for Registered Dietitians, RD, and Licensed Dietitians, LD, which emphasize evidence-based practice, client-centered care, and professional accountability. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that goes beyond simply recommending a vegan diet. It acknowledges the potential for specific nutrient shortfalls in vegan diets, e.g., vitamin B12, iron, calcium, vitamin D, omega-3 fatty acids, zinc, iodine, and proactively addresses them through targeted dietary strategies, and if necessary, supplementation. This aligns with the ethical obligation to provide safe and effective nutrition care, ensuring the athlete's health and performance are not compromised. It also adheres to the principle of evidence-based practice by considering established nutritional guidelines for vegan athletes. An incorrect approach that focuses solely on increasing caloric intake without considering nutrient density or specific micronutrient needs would be professionally unacceptable. This fails to address the unique challenges of a vegan diet and could lead to deficiencies, impacting the athlete's health and performance, and potentially violating the ethical duty to provide competent care. Another incorrect approach that involves recommending specific supplements without a thorough assessment of the athlete's dietary intake and potential deficiencies would also be problematic. This could lead to unnecessary expense, potential for adverse effects, and a failure to prioritize whole food sources, which is generally considered the foundation of optimal nutrition. Furthermore, recommending supplements without understanding their bioavailability and interactions within a vegan diet demonstrates a lack of specialized knowledge. A third incorrect approach that involves making definitive pronouncements about the athlete's performance being solely limited by their vegan diet, without a comprehensive evaluation, is speculative and unprofessional. It oversimplifies a complex issue and fails to acknowledge other potential performance-limiting factors. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough nutritional assessment, including dietary intake analysis, medical history, and performance goals. 2. Identify potential nutrient gaps based on the athlete's dietary pattern and individual needs. 3. Develop an individualized nutrition plan that prioritizes whole foods and addresses identified gaps through strategic food choices, and if indicated, evidence-based supplementation. 4. Educate the athlete on the rationale behind the recommendations and empower them to make informed choices. 5. Monitor the athlete's progress, health status, and performance, making adjustments to the plan as needed. This process ensures that care is client-centered, evidence-based, and ethically sound, adhering to the standards of practice for sports dietetics. Question 17. Stakeholder feedback indicates that some athletes express frustration with the perceived complexity of performance nutrition, often seeking readily available solutions. An athlete reports feeling fatigued and experiencing decreased performance, attributing it solely to a lack of specific supplements they have seen advertised. They are requesting an immediate supplement regimen to address these issues. As a board-certified specialist in sports dietetics, CSSD, what is the most appropriate initial course of action? Option A. Immediately recommend a popular, widely advertised sports supplement that claims to boost energy and combat fatigue, as this is what the athlete is requesting and may provide a quick perceived solution. Option B. Advise the athlete to discontinue all current dietary intake and focus solely on a liquid diet supplemented with a broad-spectrum multivitamin and mineral, as this simplifies nutrient delivery. Option C. Conduct a comprehensive nutritional assessment, including a detailed dietary intake analysis and hydration status evaluation, to identify potential deficiencies or imbalances, and then develop an individualized meal plan and hydration strategy before considering any supplement recommendations. Option D. Provide the athlete with a generic list of common sports supplements and instruct them to choose those they believe will address their symptoms, based on their own research. The correct answer is C. Conduct a comprehensive nutritional assessment, including a detailed dietary intake analysis and hydration status evaluation, to identify potential deficiencies or imbalances, and then develop an individualized meal plan and hydration strategy before considering any supplement recommendations. Explanation. This scenario is professionally challenging because it requires the sports dietitian to balance the athlete's perceived needs and preferences with evidence-based practice and regulatory guidelines for performance nutrition. The athlete's desire for a quick fix through supplements, coupled with their limited understanding of foundational nutrition, creates a risk of inappropriate recommendations that could be ineffective, potentially harmful, or violate professional standards. Careful judgment is required to address the athlete's immediate concerns, while establishing a sustainable and effective long-term plan. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and education before implementing specific strategies. This aligns with the ethical obligation to provide individualized care based on the athlete's unique physiology, training demands, and goals. Developing a meal plan that addresses macronutrient and micronutrient needs, coupled with appropriate hydration strategies, forms the bedrock of performance enhancement. Supplement recommendations should only be considered after foundational nutrition is optimized and should be evidence-based, safe, and compliant with relevant anti-doping regulations. This approach ensures that the athlete receives a holistic and scientifically sound plan, minimizing risks and maximizing potential benefits, all within the scope of practice for a CSSD. An incorrect approach that focuses solely on supplement recommendations without a thorough assessment of the athlete's diet and hydration is a significant regulatory and ethical failure. This bypasses the fundamental principles of sports nutrition and could lead to the athlete neglecting essential dietary components, potentially causing nutrient deficiencies or imbalances. Furthermore, recommending supplements without understanding their interaction with the athlete's diet or potential for contamination could violate guidelines regarding product safety and efficacy. Another incorrect approach that prioritizes the athlete's anecdotal experience over scientific evidence is also professionally unacceptable. While athlete feedback is valuable, it should not supersede established scientific principles and regulatory frameworks. Relying on unverified claims or trends without critical evaluation can lead to the recommendation of ineffective or even harmful substances, potentially exposing the athlete to risks and violating the duty of care. The professional reasoning process for similar situations should involve a systematic approach. 1. Conduct a thorough nutritional assessment, including dietary intake, hydration status, training load, and health history. 2. Educate the athlete on fundamental sports nutrition principles, emphasizing the importance of a balanced diet and adequate hydration as the primary drivers of performance. 3. Develop an individualized meal plan that meets the athlete's specific energy, macronutrient, and micronutrient requirements. 4. Implement evidence-based hydration strategies tailored to the athlete's training and environmental conditions. 5. Evaluate the necessity and appropriateness of any supplement recommendations based on scientific evidence, safety, and regulatory compliance, only after foundational nutrition is addressed. 6. Continuously monitor the athlete's progress, adjust the plan as needed, and provide ongoing education and support. Question 18. System analysis indicates that a collegiate swimmer expresses dissatisfaction with the current team-provided pre-competition meal, stating it feels too heavy and is impacting their perceived energy levels during the event. As the board's certified specialist in sports dietetics, CSSD, for the program, what is the most appropriate initial course of action to address this athlete's concern while upholding the integrity of the sports nutrition program? Option A. Advise the swimmer to research popular pre-competition fueling strategies online and implement any that seem appealing, regardless of scientific evidence or team guidelines. Option B. Schedule a one-on-one meeting with the swimmer to gather detailed information about their current pre-competition fueling habits, perceived issues with the team meal, and individual performance goals, then collaboratively develop an evidence-based, individualized fueling strategy that can be integrated into their routine. Option C. Inform the swimmer that the team meal is designed for optimal performance for all athletes and that individual preferences cannot be accommodated due to logistical constraints. Option D. Immediately revise the team's pre-competition meal to include lighter options, such as fruit and yogurt, without further consultation with the athlete or review of their current dietary intake. The correct answer is B. Schedule a one-on-one meeting with the swimmer to gather detailed information about their current pre-competition fueling habits, perceived issues with the team meal, and individual performance goals, then collaboratively develop an evidence-based, individualized fueling strategy that can be integrated into their routine. Explanation. Scenario analysis. This scenario presents a common implementation challenge for a sports dietitian working with a collegiate athletic program. The challenge lies in balancing the athlete's perceived needs and preferences with evidence-based sports nutrition principles and the practical realities of team logistics and available resources. The dietitian must navigate potential conflicts between individual athlete desires, team-wide dietary guidelines, and the need for consistent, effective fueling strategies that support performance and recovery. The pressure to accommodate individual requests while maintaining program integrity requires careful judgment and a strong understanding of both scientific principles and practical application. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based strategy that addresses the athlete's concerns within the broader context of team nutrition. This involves gathering comprehensive information about the athlete's current diet, training load, and specific performance goals. It then requires educating the athlete on the scientific rationale behind recommended fueling strategies, explaining how these strategies align with their individual needs and team objectives. Finally, it involves collaboratively developing a practical, individualized plan that integrates these principles into their daily routine, considering their preferences and lifestyle. This approach represents best professional practice because it is athlete-centered, evidence-based, and promotes long-term adherence and understanding, aligning with the ethical obligation to provide competent and individualized care. It also respects the athlete's autonomy while guiding them toward optimal nutrition. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the athlete's concerns and rigidly enforcing a predetermined team meal plan without further investigation. This fails to acknowledge the athlete's individual needs and potential underlying issues, potentially leading to resentment, non-adherence, and a breakdown in the professional relationship. Ethically, this approach violates the principle of individualized care and could be seen as negligent if the athlete's concerns are valid and impact their performance or health. Another incorrect approach is to blindly accommodate every individual request without considering the scientific evidence or the practical implications for the team. This can lead to inconsistent fueling strategies, potential nutrient deficiencies or excesses, and undermine the overall effectiveness of the sports nutrition program. It also fails to uphold the dietitian's responsibility to provide evidence-based guidance and could lead to the promotion of suboptimal or even harmful dietary practices. A third incorrect approach is to rely solely on anecdotal evidence or popular trends without critically evaluating their scientific validity or suitability for the athlete. This demonstrates a lack of professional due diligence and could lead to the implementation of ineffective or potentially detrimental dietary interventions. It fails to meet the standard of care expected of a board-certified specialist in sports dietetics. Professional reasoning. Professionals should employ a structured decision-making process that begins with thorough assessment, followed by evidence-based intervention planning and ongoing evaluation. This involves active listening to the athlete's concerns, critically appraising available scientific literature, considering practical constraints, and fostering a collaborative relationship. When faced with conflicting information or requests, professionals should prioritize evidence-based recommendations, clearly communicate the rationale behind their guidance, and work with the individual to find practical solutions that align with their goals and the program's objectives. Question 19. Quality control measures reveal that a sports dietitian's recently published article on optimizing carbohydrate metabolism for endurance athletes contains information that appears to contradict established scientific literature regarding glycogen synthesis rates. The sports dietitian who discovered this discrepancy is currently advising an elite athlete who has been following the advice from the published article. The sports dietitian must decide how to proceed. Option A. Discuss the perceived inaccuracies in the published article with other sports dietitians in a public forum to gauge their opinions before taking any action. Option B. Directly contact the author of the published article to request clarification and supporting data for their findings, while continuing to advise the athlete based on the most current and widely accepted scientific understanding of carbohydrate metabolism until a resolution is reached. Option C. Continue to advise the athlete using the information from the published article, assuming the author's findings are correct, and avoid questioning the established literature. Option D. Immediately disregard the published article and inform the athlete that the information they have been following is incorrect, without attempting to verify the discrepancy with the author. The correct answer is B. Directly contact the author of the published article to request clarification and supporting data for their findings, while continuing to advise the athlete based on the most current and widely accepted scientific understanding of carbohydrate metabolism until a resolution is reached. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical obligation to provide accurate and evidence-based nutritional guidance while navigating a situation where a colleague's published work may contain inaccuracies. The sports dietitian must balance their duty to their client with the professional relationships and the integrity of the field. The potential for misinformation to negatively impact an athlete's performance and health, especially concerning macronutrient metabolism, necessitates a careful and principled response. Correct approach analysis. The correct approach prioritizes client well-being and professional integrity by seeking clarification and evidence directly from the source. This aligns with the ethical principles of honesty, competence, and due diligence expected of a board-certified specialist in sports dietetics, CSSD. By directly addressing the colleague and requesting supporting data, the dietitian upholds the highest standards of practice, ensuring that their advice to the athlete is based on sound scientific principles and verifiable information. This proactive and collaborative approach fosters professional growth and maintains trust within the sports nutrition community. It also adheres to the implicit regulatory expectation of maintaining current and accurate knowledge in the field. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the colleague's work and providing the athlete with contradictory information without attempting to verify the discrepancy. This is professionally unacceptable as it bypasses due diligence and could lead to unnecessary conflict or damage professional relationships without a solid foundation. It fails to uphold the principle of seeking truth and accuracy before making definitive pronouncements. Another incorrect approach is to ignore the discrepancy and continue to rely on the potentially flawed information. This represents a failure of competence and a breach of the duty of care to the athlete. It allows misinformation to persist, potentially harming the athlete's understanding and application of crucial macronutrient metabolism principles. This approach also undermines the credibility of the CSSD credential. A third incorrect approach is to spread concerns about the colleague's work to other professionals without first attempting to resolve the issue directly with the colleague. This constitutes unprofessional conduct and can damage reputations unfairly. It violates principles of collegiality and constructive problem-solving, prioritizing gossip over evidence-based resolution. Professional reasoning. Professionals in this situation should employ a decision-making framework that emphasizes evidence-based practice, ethical conduct, and collegiality. This involves 1. Identifying the discrepancy and its potential impact. 2. Seeking direct clarification and supporting evidence from the source of the information. 3. Evaluating the evidence objectively. 4. If necessary, consulting with a trusted mentor or professional body for guidance. 5. Communicating findings and recommendations to the client clearly and transparently, always prioritizing their health and performance. Question 20. Risk assessment procedures indicate that an elite cyclist who has been training consistently for 5 years and has a high VO2 max is experiencing a plateau in performance during prolonged, high-intensity interval training sessions. Considering the metabolic adaptations to chronic endurance exercise, which of the following nutritional strategies is most likely to support improved performance and recovery in this specific scenario? Option A. Recommend a high-fat, low-carbohydrate diet to promote enhanced fat adaptation and spare glycogen stores during prolonged exercise. Option B. Suggest a significantly reduced overall caloric intake to encourage the body to utilize stored body fat more efficiently for energy during exercise. Option C. Emphasize a moderate carbohydrate intake throughout the day, focusing on timing around training sessions to maximize glycogen replenishment and minimize reliance on fat oxidation during intense efforts. Option D. Prioritize a high protein intake to support muscle repair and growth, with minimal focus on carbohydrate availability as the primary energy source. The correct answer is C. Emphasize a moderate carbohydrate intake throughout the day, focusing on timing around training sessions to maximize glycogen replenishment and minimize reliance on fat oxidation during intense efforts. Explanation. Scenario analysis. This scenario presents a common challenge for sports dietitians, interpreting and applying complex physiological data to individualize nutrition recommendations for athletes. The challenge lies in moving beyond generalized knowledge of metabolic adaptations to exercise and demonstrating a nuanced understanding of how an athlete's training status, exercise modality, and specific training phase influence acute and chronic metabolic responses. Misinterpreting these adaptations can lead to suboptimal fueling strategies, potentially impacting performance, recovery, and even health. Correct approach analysis. The correct approach involves synthesizing information about the athlete's current training load, the specific demands of their sport, and their training history to predict their metabolic profile. This requires understanding how chronic training leads to adaptations like increased mitochondrial density, enhanced fat oxidation capacity, and improved glycogen storage and utilization. It also necessitates recognizing how acute exercise, particularly high-intensity or prolonged endurance exercise, acutely depletes glycogen stores and increases reliance on fat oxidation as intensity decreases. A sports dietitian must then translate these physiological insights into practical, evidence-based nutrition strategies that support the athlete's specific needs, such as optimizing carbohydrate intake for glycogen replenishment, ensuring adequate protein for muscle repair, and considering micronutrient status. This approach aligns with the CSSD role in providing evidence-based, individualized nutrition care, adhering to professional practice guidelines that emphasize a thorough assessment and personalized plan. Incorrect approaches analysis. One incorrect approach would be to apply a one-size-fits-all carbohydrate intake recommendation based solely on the duration of the exercise session, without considering the athlete's training status or the intensity of the exercise. This fails to acknowledge the chronic adaptations in trained individuals, who may have a greater capacity for fat oxidation, and thus require a proportionally different carbohydrate intake compared to an untrained individual performing the same exercise. This approach risks under- or overfueling, impacting performance and recovery, and deviates from the CSSD standard of individualized care. Another incorrect approach would be to focus exclusively on macronutrient recommendations and neglect the potential impact of acute exercise on fluid and electrolyte balance, or the chronic adaptations related to micronutrient status that support energy metabolism. This narrow focus overlooks critical aspects of sports nutrition that are directly influenced by metabolic responses to exercise and can lead to incomplete or ineffective nutrition plans, failing to meet the comprehensive needs of the athlete as expected of a CSSD. A third incorrect approach would be to recommend dietary supplements without a thorough assessment of the athlete's actual nutritional deficiencies or the specific metabolic demands that could be addressed by supplementation. Relying on supplements as a primary strategy, rather than optimizing whole food intake based on metabolic adaptations, is not evidence-based and can be ethically questionable if not supported by a clear rationale tied to the athlete's physiological state and performance goals. This bypasses the fundamental principles of sports nutrition and the CSSD responsibility to prioritize dietary strategies. Professional reasoning. When faced with an athlete's performance data and training logs, a sports dietitian should first conduct a comprehensive assessment. This involves understanding the athlete's sport, training history, current training phase, and any reported performance or recovery issues. The next step is to analyze the acute and chronic metabolic demands of their training and competition. This analysis should then inform the development of an individualized nutrition plan that addresses macronutrient, micronutrient, and fluid needs, prioritizing whole foods and evidence-based strategies. Regular reassessment and adjustment of the plan based on the athlete's response are crucial. This systematic, athlete-centered approach ensures that recommendations are physiologically sound, ethically responsible, and aligned with the highest standards of sports dietetics practice.